I'm Alice Park, Senior Health Correspondent for TIME, and I'm joined today by former Senate Majority Leader and founder of Nashville Health, Dr. Bill Frist. Dr. Frist, welcome to TIME100 Talks.
Thank you, Alice. Good to be with you.
So let's start with the upcoming election and the very first presidential debate. There wasn't much of a solid exchange of ideas or even laying the groundwork for what Americans can expect in the next 4 years from either President Trump or Vice President Biden, especially in the area of health and health reform. What did you take away from the debate?
Well, the debates were discouraging, and we don't need to go into all of that. But in terms of, I think, of the way both candidates came across, and maybe the moderator, but in terms of health, the Republicans really have not put a health plan on the table, either for public health or for private health, more acute health or for preventive medicine. They just haven't. They haven't done it over the last 4 years. That's disappointing to me as a Republican. On the Democratic side, Joe Biden, I've interacted with him a lot. I served with him for 12 years. I was majority leader over Joe Biden for 4 years, so I know him well. He's been very committed to, we all know, cancer, in part because of his son, but for 2 years, he literally traveled the country and the world. I saw him in Rome one time talking and addressing the Pope about the importance of cancer treatment, research, the moonshot, they called it. He is more deeply embedded in the organic part of medicine. In terms of policy, all we know is that he's going to support Obamacare. Obamacare is really only about 20 million people today. It's not 350 million people, and Medicaid expansion, but he says he wants to improve that, does not want to give away and ignore private health insurance. So he didn't shift at all. He stayed right where he was, but he made the statement more towards the center in healthcare, rejecting the more extreme Medicare for all. So on one side, you have no plan in terms of the president, and on the other, you have this deep experience with cancer and the sort of impact of what he will do. But again, no specifics in the plan other than supporting Obamacare.
And of course, we've been battling a major public health crisis in COVID-19 this year. How would you grade the U.S. response to the pandemic?
I've been on this a long time, and when I was in the Senate back in 2005, gave a series of speeches 20 different times on the coming pandemic and the fact we needed a Manhattan Project in order to predict what was inevitable, another pandemic, or at least another virus that could create. It's inevitable. It's science. It's what the virus does. It's what it's done for thousands, millions of years. And I would give us a B if you go back to last 15 years, because we established things like BARDA. We invested more in some partnerships of potentially creating vaccines alike. BARDA is a bioterrorism related entity that we created. So I give us a B and not an A because we were so ill-equipped this time around because of the lack of investment predominantly in public health infrastructure. We kind of forgotten what was happening in early 2000. We've forgotten the earlier pandemics. We forgot what happened back, 1918. We just forgot all of that. And so I would not give us an A because we were not equipped. We weren't equipped in terms of communication, in terms of research, in terms of public health infrastructure, in terms of antiviral agents. And now since then, which is probably where your question was, I would give us a B and might go to a B plus. I give us a B plus because I think more recently, as we've looked at data that we've learned, we have responded with a clearer voice. But I think the president should not have been the one communicating the medical science. We got off on issues like not wearing masks when it is proven, the science is there, that mask works, it is life-saving. The communication issue, I would give a D to. And if you look back at my writings in 2005 and all of my speeches then, I put the importance of communication in public health emergencies, in bioterrorism, and especially in pandemics to be the most important thing, because that's where the trust needs to be built. And if that trust is not there, then the American people will not change their behavior, will not listen, will not take the vaccines, will not take the antiviral agents. So I don't think we've done very well initially. It's getting better, and it's getting better because instead of saying just trust the scientists, people are saying let's trust the data. As we learn what works, let's implement that into our public policy.
Other people in public health have given the U.S. a failing grade on the response so far. Does the number of deaths and cases that we're seeing, does that surprise you? Did you think it would get to this point when the pandemic began at the start of the year?
Yeah, you know, the fact that 4% of the population is here and we have 20% of the deaths, that by definition is F. That is a failing. And so, but is it all government response, or is it lack of individual responsiveness to the behavior itself? So it's easy to blame either one person, say the president of the United States, but I think it's much more complex than that. And we're all at fault. We've underinvested in public health. Just since in 2004, 2005, if you look at the amount of funding for people on the front line, in our state epidemiologists, in our local public health departments, there have been 56,000 people fewer today in those frontline jobs in public health than there were just since the Great Recession, not that long ago. As I was going to say, since I was in government officially back 2004, 2005, overall funding for our local health departments, the health department that's 5 miles from our viewers and our listeners now, has been cut. The funding has been cut on the front line by about a third since 2003, 4, 5, and 6. So that explains a lot of the lack of preparedness. That explains the 4% versus 20% of the deaths is there. So it's not all just the leadership or just this administration. It's a lack of preparation. And then the response to it, of course, has been inadequate, which is where my B comes in.
And you're a physician, surgeon, and as you said, one of very few senators to bring that kind of a background to Congress. Having seen the process from both sides, as a physician and as a representative, why do you think health in the United States is so politicized? We've seen it with drug pricing. We've seen it with our response to global pandemics like HIV and COVID-19. Why do you think it's so politicized?
Well, it's interesting. On the public health and sort of acute health, I was a heart transplant surgeon, so I took people's hearts out, put new hearts in, and took care of people with heart disease. But then when I transplanted that heart, I would send them back to their community. And the community and whether or not they survived, because I had to give them immunosuppressants, would depend on if it was a lung transplant, was the air clean? Is the water clean that they swim in or that they bathe in or that they mix their medicines in? So my understanding of public health was really that. And I fought biases in my transplant. So all this was sort of second nature to me. But when I came to the United States Senate in 1996, there had not been a physician or a nurse in the United States Senate in 68 years. And so there's a fundamental lack of understanding at that level, with 18% of our economy in healthcare, that we actually have to inject. Obamacare, coming back to our sort of bipartisan thing, Obamacare was not, there's a lot of good things in Obamacare, and a lot of good things that are there today, a lot of negative things, but it was bipartisan. It was not bipartisan, it was nonpartisan, and therefore for the next 10 years, people are trying to tear it down. And when something would go wrongly, even if they voted for it, they said, well, it's not me, and people who didn't vote for it. So this idea of getting people together is very, very important. In terms of why healthcare is partisan today, it shouldn't be. Each one of us, as we're talking now, we have children and we have grandchildren and we have spouses who are going to get sick as we're going to get sick. We're going to all depend on the system itself. So all of us need to set certain goals to lift people up in terms of healthcare. And that's not just physical health, it's mental health, it's spiritual health, it is physical health as well as our social health as well. Now that we're expanding that definition, and people are beginning to understand that health is more than just about taking care of a patient when they get sick, we have that opportunity to bring people together. How is that going to happen? It's going to take leadership to do that. It's going to take a president of the United States who believes in that, a president who can be trusted, a president who's committed to it. If we do that, not only do we lift up 350 million people, including the most vulnerable people who COVID has shown again and again that we've left behind, that we need to lift up, and we need to look at the equities issues itself. But by doing that, number two, we lift up cities. People become more productive. They have more hope. They stay in their jobs. There's less absenteeism. And then thirdly, there's hope for the future. You know, people are down on America now and they're not looking in an optimistic way to the future. But if they are healthy and they've got a job and their family is healthy, they are more hopeful. And when they're more hopeful, they're more creative, they're more energetic, they're more giving, and they're more compassionate. And that's how important health and healthcare is to America and to the world.
And you referred to how Democrats and Republicans came together to address HIV. What lessons did you learn during your time in the Senate, during that time, about how to bring and create consensus around important issues like public health? And do you see any of those opportunities today?
Yeah, first of all, it's really important that people understand, it can be done. We doubled the funding of National Institutes of Health in a 5-year period. And we did that in a bipartisan way. We passed the Medicare bill. We passed the single largest global health bill passed by any president in the history of the world, the PEPFAR bill, that saved 20 million lives in a bipartisan way. And what it took is, number one, a president who led on it. The president, again, it doesn't have to be a president who's an expert on it. President Bush maybe had been to Africa one time before he put this on the table, but he was willing to listen. He sent Tony Fauci down to Africa. He trusted the science. Fauci came back and said, it can be done. We can lower the price and we can lead and we can save lives. Then you come down to the organic part, and this kind of is what I did in the majority, as majority leader, at that level of having people into your office, one Republican, one Democrat, very quietly, outside of the press, do it every single week. Number two would be a president, and we did this with President Bush for 2 of the years I was majority leader. Every other Friday, he would have the leadership over into the Oval Office in a quiet way, no press. So there would be Harry Reid, and there would be Nancy Pelosi sitting next to Denny Hastert at the time with me in the room. And that, even though it can be awkward, but sitting around a table in that kind of privacy with 6 people on a regular basis, to me, would revolutionize where we are today. Because it sends the signal to the leadership that bipartisanship, even if we don't get along, we have certain goals. It's the American people we're going to serve and can bring them together. So again, that's at the congressional level. What you have to do is for HIV/AIDS, what I did is talk to Jesse Helms, who had been again. He said this virus was evil. It was morally wrong. But after we talked about it and brought people in the room, he basically came on board. We already had a lot of the sort of liberal advocates on the board. That sort of organic thing is made possible if the leadership at the top says that bipartisanship is important. Don't sacrifice your principles, but bipartisanship is important. Tom Daschle and I have an editorial on election integrity in the Washington Post. 30 of us got together, elected officials from the past, and the National Council on Election Integrity is what we call the group. And so Tom and I said, well, if we're going to be out there saying that every vote counts, every vote needs to be counted, the most important thing people can do is vote, and we have to ensure integrity of the system, which is what the editorial is about. Equally importantly is that you got 30 people from both sides of the aisle. And Senator Daschle and I, he was leader on the other side, and I was leader, and we, represented our parties. Since we left the United States Senate, we've probably written 30 to 40 op-ed pieces together. And again, we don't agree on everything. And we've probably done 60 to 70 speaking engagements together. I think we need to see more of that. It's not just with past people like us who are not on the forefront anymore, but see more of that among our elected leaders today.
How confident are you that we will have a vaccine against COVID-19?
100%. Again, by understanding the virus itself and where science is today, not where it was 10 years ago or 15 years ago, we know that we can make the connectors, these little spikes coming out, we know we can incapacitate, in essence, the virus itself. The neat thing about it is we have other ways of both treating and other types of virus to make itself. And with that, I'm very confident being made. And as I said back in 2005, the real issue is going to be the manufacturing of it. And this administration has done a superb job, in paralleling the manufacturing at the same time we're figuring out the science, so that when we get the science and it is a safe vaccine, We can make it for sure. So that's the answer to your question. We have the vaccine. We got to make sure it's safe. But as soon as we know it's safe, we'll be able to start distributing it. And then the distribution is going to come back. Is it equitable distribution? I think it is wrong that the United States has chosen, or the president has chosen, not to participate in the global forums to ensure equitable distribution of vaccine. I think it hurts the world. It hurts our image in the world. It hurts humanity itself. But right now, a lot of people, and I'm working with the administration as many other people, to ensure an equitable distribution of this vaccine. It is not the holy grail. For too long, people have said, let's wait till the vaccine, we can all go back to work. It's going to be a year before we can get back to normal, some sense of normalcy in our lives, to where we're not waking up in the middle of the night with anxiety about it. I see the vaccine, probably before the end of the year, we'll have 2 vaccines that we know work, that will have very good evidence that they are safe, and that people will begin to be vaccinated before the end of the year. It'll be, health personnel, people who are on the front lines. But it won't be another 6 months. I'm just predicting. I don't know more than anybody else, except I'm talking to smart people. I think it'll be 6 months before people will be really getting the vaccine, and it'll be easy to get. We'll understand it, and we'll actually trust it. The anti-vax movement is setting us back a long way, but that just means we need to make sure this vaccine is absolutely safe before we put it in the field.
And you referred to the drops in support and funding support for our public health system. And it's going to be the public health system that really bears responsibility for distributing this vaccine if and when we get one. How confident are you that that system is ready and will be able to equitably and efficiently distribute this vaccine or vaccines when they come?
I feel good about it. But until we're underway and we see both the safety profile, which we've got to have up front, but we see where the need is, and we'll do that, or it will be done in a way, as I suggested, taking populations of people like healthcare personnel. Back when I was a resident at Mass General in medicine, the hepatitis vaccine was a new vaccine. And it was in the same sort of process. That's back when vaccines would take 8 years to make. And we're making this one in 8 months, which is pretty amazing. That's fast. It's good. But we got the vaccine, and we were the first ones protected. And it was about 6 months later before it was really broadly commercially available that people were really comfortable with that. And that sort of distribution, with the amount of meetings being held and campaigns focusing on vulnerable populations, on distribution to the appropriate people, I feel very good about where we are today. But it's going to be hard. I know the president of the debate mentioned the military is going to be on the forefront, and that's good. And I have huge respect for the military, but there is a huge distrust of institutions today, and not necessarily the military, but people in uniform, and we have to work through that. The people of color today who have been disproportionately impacted in horrible and terrible ways today, right now, 8 months into this. Then we have vaccine distribution. Is there going to be trust there? We need empathetic people who can put themselves in the shoes and in the lives of people, vulnerable populations most importantly, and then develop the system around that. And I feel good where we are today. I'm not going to relax for a year until we actually have that occur. I will just say I'm disappointed that our country has chosen not to participate at an organizational level in the world community. Our community health depends on our national health, and our national health depends on global health. And if we can't figure to capture these viruses early with good surveillance, with an investment in the infrastructure, in public health, they'll be right back around. I don't care what the vaccine is, and we'll start all over once again. And that's why we have to have not cutting funding at the local level and the state level, but increased funding around the world, because our health, where you're sitting and I'm sitting, and in our communities, ultimately determines our national health, and that is determined by global health.
Finally, Dr. Frist, I want to come back around to something you brought up, which was election integrity. And it seems that equally important is, of course, getting people to vote in the first place. And how do you do that? And with the threat of COVID-19 still looming, so many are probably facing a difficult decision about whether to exercise their civic duty and to vote. or listen to public health experts, who say to avoid public crowds that could be, gathering around polling places. What's your advice to the American public on voting during a pandemic?
Well, as I said in our op-ed with Tom Daschle, Senator Daschle, everybody must vote, should vote. It's probably the most primary responsibility, civic responsibility we have that determines things like how COVID is handled coming in. The second thing is that vote is really got to count. That means it has to be read. Elections can't be, sped up arbitrarily. That we need to count each one of those votes. And that's all part of trust and integrity in the system. The debate was not helpful when you had the president basically saying it's a sham, you can't trust it coming on. That's not the way to address it, or it's not presidential to address it that way because it doesn't reflect fact. And I think the fact is when you've had the military for generations voting by ballot, not in person, and we have 46 states that have been actively doing it in the past and have not seen the corruption there that is implied, means that everybody needs to vote. If you can vote in person, I'm going to vote in person just because I want to make it sort of crystal clear, and I can't predict what people are thinking now. But if not, the ballots are out there, and there's early voting that's out there. You just encourage people to vote. These are unprecedented times, and we didn't cause the virus, and China didn't cause the virus. The virus is just smarter than us. But if you put the virus into the economy and to the impact on, people in my family have had the virus, but the impact also on our economy and the people who've lost their jobs and the service industry, you see the impact. Our leaders do matter, and the voice matters. And as I talked earlier, bipartisanship matters if we want to transform and change it. And it's going to come from the top. And our senators are important and our House members are important. But voting for who you feel will do the right thing for you for generations ahead is absolutely critical. The integrity of the process is there. So now it's getting people out to vote. And, both parties will be working that in the best way that they can.
Dr. Frist, thank you so much for your time. We truly enjoyed having you on Time 100 Talks.
Thank you. Great to be with you. Appreciate it.